Well, at this time, the guidelines really don't recommend screening for bladder cancer. There are a couple of issues, but the main issue is that the incidence of bladder cancer is quite low in the general population, and even screening for prostate cancer is a bit controversial, as you know, mainly because the testing has issues with reliability. And I'm not going to get into the controversies of PSA screening, but for bladder cancer, where the incidence is quite a bit less than in prostate cancer, it's very challenging to make sure that you're not having too many false positives from any of the urine markers currently. I think the more important area that we need to consider is in patients with hematuria. Microscopic hematuria, for example, is found in about 10 to 14% of adults, and the vast majority of patients with microscopic blood don't get referred to urologists. And yet we know that about 1 in 4 patients who get diagnosed with bladder cancer have muscle-invasive disease at the time of diagnosis. And so there's certainly an opportunity to find disease earlier. And one of the areas to do that is by trying to increase the number of patients with microscopic blood who get evaluated, and perhaps even more importantly, finding the patients most likely to have bladder cancer based on risk factors such as age, carcinogen exposures such as tobacco, and even gender, because men are 4 times more likely to get bladder cancer than women. And at this time, primary care physicians are not referring many patients, including high-risk patients. It's quite possible that a urine marker might help triage patients appropriately for evaluation and help sort out which patients with hematuria need to get evaluated versus which ones can be observed.